Now globally, there's a couple different strategies for managing BVD. What the Yanks like doing is vaccinating. They love it. The vaccines are cheap. We've got, again, there's 160 licensed BVD vaccines in the US when I moved here 10 years ago, so now there's probably a couple hundred. And the idea is you immunize the cow, and if she gets exposed to the virus, not much virus will reproduce, and so that'll protect the fetus. Problem is, it only takes 1 or 2 viral particles to cross that membrane, the placenta, into that calf, because she has immunity, but her calf has nothing. And that's the problem with BVD. So if BVD sneaks through that placenta and gets in there with that calf, it'll start partying in there, and that calf will think that BVD is normal, and it'll be born a PI. And so there isn't a vaccine globally that's 100% protective for fetal protection. The vaccine we've got in Australia is about 80%, which doesn't sound great, but it ain't bad. Now in the rest of the world, especially in Europe, this is the Yanks, there's a strategy to go in and just hell for breakfast, get rid of all the PIs. So they'll literally ear notch the whole dang population of animals and remove all the PIs. You remove the PIs, you remove the exposure to the virus, and they can eradicate BVD just by testing everything. And they don't use vaccines in those countries because they're worried that vaccines will hide the ability to do serology, blood testing. You vaccinate an animal that's got immunity. It makes it hard to blood test and interpret those results. So they said, no, don't use vaccine, because then we won't know if there's any PIs around, because they're trying to do it on a nationwide scale. And they've been successful. Now in Australia, we didn't have ear notching, and we didn't have a vaccine. So historically, people auto-vaccinated, and it was a pretty good idea. So the idea is, we know getting exposed to a PI when you're pregnant is bad. So people would go find a PI and they would intentionally expose their heifers prior to mating. And it's a reasonable idea, but there are better options now that we have a vaccine that works. Because being auto-vaccinated isn't being vaccinated, you're actually giving those animals BVD. Now individually, each of those strategies, for the most part, is non-systematic. So they're kind of like partial programs. The problem with a partial program is it's going to result in partial control. I was talking to Matt earlier about it. The vaccine's pretty bloody handy. It's about 80%. But with just straight vaccination, you're going to reduce the number of PIs produced. If you reduce the number of PIs produced, you're going to be more likely to get a group of females come through without a PI within them. And now you've got a greater chance of having a population of animals that are not immune on a farm that still has PIs, because the vaccine won't turn PIs into non-PIs, and the vaccine will still allow the occasional PI to be born. So you reduce the cost of BVD, and you've kind of set yourself up to have a mini wreck. Now the vaccine is great in that it reduces the impact of BVD. In my opinion, blanket vaccinating your herd is like running your sprinklers in a rainstorm. We should vaccinate animals without immunity. We should use blood testing to screen groups of animals and act appropriately, either remove the PI or vaccinate them depending upon the situation. Removing PIs, if you're going to do it, you want a structured program. These European structures did it, just kind of randomly PI testing animals and getting rid of scungy buggers is like trying to muster a mob of sheep one at a time. And the idea, lastly, auto-vaccination. Let's bring him in, let's immunize everybody. Well, let's talk about him for a second. So here you got this lovely line of beautiful cows, and we're going to auto-vaccinate them. So we're going to go find this bugger that we got from the sale barn, conceivably, who may have Tyleria, may have Johne's disease. Who knows what in the hell this guy's got? Why would we want to use him to make these girls all sick with BVD when we don't even know what he's got? Do you see one of the risks? Plus, what are we going to do with him when he's not around these girls? Are we going to let him live in the back room of the house because the kids have gone to college? We've got to protect all the other animals on the farm because we don't know if they've all seroconverted, all have immunity, and we also have to protect our neighbors. Lastly, this guy's going to die, so then we're going to have to go buy another one. So we keep having to go and top up on potentials to bring new great stuff home. So auto-vaccination is pretty straightforward. The idea is to immunize animals in a window that's going to be better than getting exposed during pregnancy. Yeah, it's got better immunity than vaccination, no doubt. An animal that seroconverts to BVD is about 100% immunity for a fair while. But it carries a lot of risk. One, auto-vaccinators, you need to make sure they're PIs. Sometimes people get a scungy calf, put it in with them, and he's just got Tyleria. Ensure sufficient time for the vaccinated animals to recover. So again, BVD causes immune suppression, so don't do it when they're stressed, and don't do it even within a couple of months of mating. PI animals are also susceptible to all sorts of weird stuff, so be prepared to also bring something else to the farm. Mismated heifers are going to produce PIs. Adjacent pregnancies, that's a risk. Adjacent neighbor pregnancies could be potential liability. Auto-vaccinated animals should be screened to make sure the PI actually did its job. Some PIs aren't as good as others at transmitting the virus. And if your strategy is effective, again, maintaining that supply of PI is going to be pretty difficult. PIs usually die prematurely, painfully, and without salvage value. So by the time they waste away, you might have paid a bit of money for that PI. By the time you're done with him, he ain't worth anything. You've wrung all the goodie out of it. So again, systematic BVD controls about managing these PIs. So where appropriate, finding and getting rid of them, and vaccinating animals without immunity, and then to surveil against reintroduction. The easiest way to reintroduce BVD is to bring in a Trojan cow. That's a pregnant cow carrying a PI. So it's the easiest way to do it. PI bulls, there's a few of them out there, but that's the easiest thing to do. Buying in someone's preg-tested in-calf heifer, especially if it's gone to a big sale where there's a lot of animals commingled in one location. So the systematic management, one, you need to know where your herd sits. So now we're back to you guys. All right, so an individual herd, we need to know where you sit. Do you have BVD? If you're BVD free, it's pretty easy. We're just gonna start vaccinating your heifers conceivably. Or if you've been doing it well for a long time, at least monitor your heifers. Every producer I work with, I want them to work with their veterinarian to blood test their heifers before they mate them. If they're highly immune, let's do something about it. If they're not highly immune, let's do something about it. But first off, you want to know your herd status. So the way to do that is to blood test every existing management group to see if you can find, like you guys might be the 5-year-old cows, will bleed a handful of you, you got no immunity, we need to vaccinate you girls. So the main step is to find out, one, if you've got it, and two, to address the immune status of management groups without immunity. You with me? That's cool. So we're screening the individual management groups, vaccinating the ones that don't have immunity. Step two is to find and remove PIs where appropriate and make sure no more PIs enter the breeding herd. Now this is our heifer replacement stuff. We're going to screen our heifers before we mate them. We're going to find the PIs where appropriate. And in so doing, we're going to make sure that no more PIs enter the breeding herd. If you're buying in animals, you need to figure out a strategy for them as well. Ear notch them on arrival. If they're pregnant when they arrive, leave them where they're at, test their calves. And then this step 4 is protecting the naive animals. So any animal that doesn't have immunity, let's vaccinate them. And then just simple biosecurity. Really, BVD biosecurity is really all about just making sure you don't bring animals that you don't know the status of onto your place. Well, if they do get there, keep them on their own, quarantine them, and then test them. Anytime you bring an animal on your farm, it's a good idea to let it sit for at least 2 weeks, if not a month, before you go putting it in with other animals. Because most of our viruses, just like the flu, are transient. You know, if you could get your kids to sit on the porch for 2 weeks when they got home from kindergarten, they wouldn't bring the flu home to your house. So we're going to use this antibody test. We talk about screening heifers. So again, when I antibody test an animal or blood test an animal, my question is, do they have presence of antibodies indicating exposure? Because if they've been exposed, that means they've met a PI almost every time. A transient infection can do a little bit, but almost 99% of exposure is due to PIs. If you've got cows on your place that have immunity, they've been exposed to PI, and most likely that PI is your own PI. Relatively small numbers to do this antibody screening. Just 5% of the group of heifers, minimum of 6 animals. If you're only bleeding, say 50 heifers, bleed 6. If you got 200 heifers, bleed 10. Now these groups of animals that you're bleeding, they need to have been together for a reasonable amount of time. If they're an old cow mob, it's easy. They've been together for donkey's years, right? Pretty straightforward. You bleed them, bleed 5% and act on it. If it's a group of heifers, they need to be at least 8 months old, because they need to have had at least a couple months since their maternal antibodies went away. They need to be unvaccinated, preferably. And they need to have been in close contact for at least a couple of months. We'll bleed about 5% of them, or at least 6 to 10 of them, depending on the mob size and stocking density, and then we'll act on those results. So going back to the herd, these older management groups, you know, these existing cows with calves at foot, you know, the 3-year-olds, the 4-year-olds, the 5-year-olds, etc., bleed them. If they're highly immune, let's just keep an eye on them. If they're not highly immune, let's vaccinate them. People say, well, why don't we go in and ear notch everything? Well, usually if someone's got BVD, all those older cow mobs are immune. I don't want to run in and ear notch everything. That's not cost effective. PIs tend to die out with time. So when I've got evidence that there might be a PI in there, then we'll do some PI testing. But for the most part, I just keep an eye on them. They're not hurting anybody. There may be a PI and there might not. I want to focus on the heifers. So I want to annually screen the heifers for evidence of immunity and presence of a PI. If they're seronegative, meaning no immunity, let's vaccinate them. If they're seropositive, let's ear notch them. Keep hammering that through. So again, each new group of heifers, both PI-free and immune. So if we do that, and we're consistently still getting virus coming through in the heifers, that usually indicates there's an adult PI somewhere on the place. That makes sense? You know, a 6-year-old cow producing a PI. Next year she's a 7-year-old cow producing a PI, and that's why our heifers are coming through immune. If you're looking for some PIs, one sneaky way to find them is at calf marking to screen these PIs. Remember we talked about those point-of-care tests, or you can send them to our lab or another lab if you use a different lab. Screen those animals that look woody at calf marking. If you're sending them to us, I'd say to guys, look, you're marking a mob of 200. You test 5 calves, number them 1 through 5, send them off. Number 4 is a PI. Look in your book, see what mob it's in. That calf's in a mob of immune animals. When you find that calf number 4, see who it's nursing off of, write down her number. Next time she's in the yards, ear notch her, and if she's a PI, call her. So ear notch and identify woody calves, and then test their mothers. That's how we found this girl here. She's a nice looking Char Grey. She's a PI. She was gonna probably continue popping out PIs for years. Even though she looked great, every one of her calves wasted away and died at around 9 months of age. And that's how we found her, from her little woody calf. She was 4 years old when we found her, having her with her 3rd calf on the ground. Now, if you're still getting PIs coming through in a beef situation, a test you can do with working with your veterinarian is to screen a handful of weaned calves at weaning. So you got a management group, you wean them. You know, like a lot of my guys at home have multiple manager groups. They yard wean a group, and then they put all the calves out in the paddock, and they bring another mob in and do the same. So these weaned calves, just take a blood sample from a small proportion of them. Again, 4 or 5%, it's pretty cheap. If those calves have immunity to BVD, they've been reared with a PI. Does that make sense? So then you go back and ear notch those mothers. Pretty cool. If those calves have little or no immunity, they might have a remnant of some colostral immunity, but there's not a PI in the mob. Does that make sense? So don't worry about ear notching those mothers. And that's a way to track down these adult PIs. But normally these girls waste away and die, so it's pretty rare for them to live that long. Here's the engine room of the whole show. Annually screening those heifers for immunity. Vaccinate them if naive, ear notch them if exposed. So here's real quickly. Sometimes you have animals that have partial seroconversion. You guys are a group of heifers. We come in and we bleed, and we find that 50% of you have immunity. There's 3 possible scenarios to why 50% of you have immunity. The first one's pretty simple. The 50% that we tested at random are actually PIs. Remember, BVD PIs don't produce immunity. So what we'll do, if you guys are highly immune, is we'll test the antibody negative animals and see if you're PIs. And if you're not PIs, great. If I do find a couple PIs in that random populous subsample, then there's gonna be more, so ear notch the entire mob, and you'll go to the bulls highly immune and PI free. Usually with 50-50, they're just gonna be antibody negative. Now there's 2 reasons for them to be antibody negative. One is there's a PI in there that's a bit slow moving, hasn't gotten to know everybody. That's less common than the most common response, which is some of you girls met a PI either in calfhood or when we weaned you with all the steers, and before we choofed the steers off in the cull heifers, you got exposed, right? So if we go in and say 50% of you are immune, and the antibody negative animals are not PIs, then what we'll do is, after we confirm you're not a PI, is we'll wait another month and re-bleed those antibody negative animals. And that's why the T-GOs are nice, because you don't need to get me running it or your vet running it back and forth on your place so much. If the previously antibody negative animals have now become antibody positive, what does that tell you? You've got ongoing exposure. So you probably still got a PI in the mob. If those antibody negative animals stay antibody negative, it's probably past exposure, and you can look at the proportion of animals that are immune and then make a decision as to whether or not you want to vaccinate. And normally I say if over 80% are immune, I don't vaccinate. If it's less than 80%, I go ahead and vaccinate.